Healthcare is at the center of the government shutdown. Health insurance premiums are set to increase and Medicaid coverage to decrease. So we want to offer you some perspective this morning.
That's right. Our Jess Arnold met up with a dentist who primarily works with patients on Medicaid. She's joining us live now in studio. And Jess, these changes could really impact thousands of people.
Yes, and it could leave a lot of people in a black hole for health care coverage. Now, we're only 2 months away from the Medicaid changes taking effect, so especially if you're someone who has long-term procedures, we want to make sure that you can plan ahead.
Fixing teeth has become the easiest part of the job for D.C. dentist turned advocate Dr. Albert Coombs.
We were met, obviously, by a new hurdle, which was the new federal limits for Medicaid.
On January 1st, anyone who makes more than 138% of the federal poverty level will no longer be eligible for Medicaid. That translates to a single income of less than $22,000. Right now, it's 215%, or close to $34,000, which is already less than D.C.'s minimum wage income.
We shouldn't have people having to decide between getting health insurance or working a job.
About 80% of Dr. Coombs' patients use Medicaid. So he's turning to D.C. lawmakers like Councilmember Christina Henderson to help cover the gap for the 25,000 D.C. neighbors who stand to lose it.
We are working incredibly hard to ensure that this transition is as seamless as possible.
At the end of the year, Medicaid plans will automatically switch over to the Healthy D.C. plan. Right now, though, it doesn't cover vision or dental.
And we're trying to figure out some workaround patches.
She and Dr. Coombs agree that these Medicaid changes will cause a ripple effect for everyone.
No matter how much money you make, everybody is affected if our ecosystem is destroyed.
And it's going to take everyone to keep it healthy.
Dr. Coombs is working quickly to let his patients know about these changes. Now, open enrollment begins in D.C. on November 1st if people are interested in signing up for that Healthy D.C. plan, even if they're not making that switch from Medicaid. I'll have more info for you on WUSA9.com. Simone, Wisdom.
All right, Jess, thank you. At